liver transplant is a life-saving procedure, but it comes with a lifelong commitment to medications that help the body accept the new liver and prevent complications. If you or a loved one has undergone a liver transplant, you probably know that the road to recovery involves taking immunosuppressants, antivirals, and other essential drugs to keep the new liver functioning properly. Understanding these medications and how they work is crucial for maintaining a healthy, complication-free life post-transplant. In this video, we'll break down the top 10 medications commonly prescribed to liver transplant patients, explaining what they do, how they work, and why they're necessary. Number 1. Tacrolimus, Prograf. Tacrolimus is one of the most important immunosuppressants prescribed after a liver transplant. It works by suppressing the immune system to prevent it from attacking the transplanted liver. Since your body naturally recognizes a new organ as foreign, tacrolimus helps reduce the risk of organ rejection. However, this medication requires careful monitoring because too much can cause kidney damage, while too little can lead to rejection. Common side effects include tremors, high blood sugar, and increased infection risk. Patients usually take tacrolimus for life, though the dose may be adjusted over time. Number 2. Cyclosporine, Neoral Sandimmune. Cyclosporine is another immunosuppressant that works similarly to tacrolimus. While it's not as commonly used today, some patients may take it if tacrolimus causes severe side effects. Cyclosporine helps prevent rejection by blocking certain immune system activities, but it can cause high blood pressure, kidney problems, and excessive hair growth. Like tacrolimus, it requires regular blood tests to ensure the dose is right. Number 3. Mycophenolate mofetil, Cellcept. Mycophenolate mofetil is often used in combination with tacrolimus or cyclosporine to provide extra protection against rejection. It works by blocking the production of immune cells that could attack the liver. This medication is helpful because it reduces the need for higher doses of other immunosuppressants, which can lower the risk of severe side effects. However, it can cause diarrhea, nausea, and an increased risk of infections. Number 4. Prednisone, corticosteroids. Prednisone is a steroid that helps reduce inflammation and immune response after a liver transplant. It is often given in the early stages, post-transplant, or during episodes of organ rejection. Since long-term steroid use can lead to serious side effects like weight gain, high blood sugar, osteoporosis, and mood changes, doctors typically try to taper the dose down over time or stop it completely if possible. Number 5. Everolimus, Zortris. Everolimus is another immunosuppressant used to prevent liver rejection. It works differently than tacrolimus and cyclosporine by blocking a pathway that immune cells use to multiply. This medication is sometimes used to reduce the need for higher doses of tacrolimus, which helps lower the risk of kidney damage. Common side effects include mouth sores, high cholesterol, and increased risk of infections. We made a book, 10 questions everyone should ask their pharmacist. You can find a link in the description below. Feel free to check it out. Number 6. Sirolimus, Rapamune. Sirolimus is similar to everolimus and is sometimes used as an alternative immunosuppressant, especially in patients who develop kidney problems from tacrolimus or cyclosporine. It helps prevent rejection by inhibiting immune cell growth. While effective, sirolimus can increase the risk of slow wound healing, high cholesterol, and lung issues. Doctors typically reserve it for patients who need a different immunosuppressant option. Number 7. Valganciclovir, Valtite. Liver transplant patients have a higher risk of viral infections, especially from cytomegalovirus, CMV, which can cause serious complications. Valganciclovir is an antiviral medication that helps prevent and treat CMV infections. Patients typically take this medication for a few months post-transplant to protect against infections. Side effects may include low blood cell counts, nausea, and fatigue. Number 8. Trimethoprim sulfamethoxazole, Bactrim. Bactrim is an antibiotic prescribed to liver transplant patients to prevent infections, particularly pneumocystis pneumonia, PCP, a serious lung infection that can occur when the immune system is suppressed. This medication is usually taken for several months after transplant. Side effects can include nausea, rash, and allergic reactions. If a patient is allergic to sulfa drugs, alternative antibiotics like dapsone or atovaquone may be used. Number 9. Ursodeoxycholic acid, urso-actigol. Ursodeoxycholic acid is used to protect the liver and improve bile flow. Some liver transplant patients develop bile duct complications, and this medication helps reduce bile buildup and prevent liver damage. It is generally well tolerated, but some patients may experience mild stomach discomfort or diarrhea. Number 10. Proton pump inhibitors, omeprazole, pantoprazole. Liver transplant patients often take proton pump inhibitors, PPIs like omeprazole or pantoprazole, to protect their stomach from ulcers and acid reflux. Immunosuppressants and steroids can increase the risk of stomach irritation, so PPIs help reduce complications. Common side effects include headaches, nausea, and potential long-term risks like low magnesium levels. Taking multiple medications after a liver transplant can feel overwhelming, but strict adherence is crucial for the success of your transplant. Here are some key tips to help manage your medication routine. Set reminders. Use alarms, pill organizers, or apps to stay on track. Stick to a schedule. Take medications at the same time every day to maintain steady levels in your body. Attend regular checkups. Blood tests and doctor visits help monitor medication effectiveness and side effects. Watch for interactions. Some foods, drinks, and other medications can interfere with transplant drugs. Always check with your doctor before starting new medications. A liver transplant is a life-changing procedure, and the medications prescribed afterward are essential for keeping your new liver healthy. From immunosuppressants that prevent rejection to antivirals and antibiotics that ward off infections, each medication plays a vital role in your recovery. If you or a loved one has had a liver transplant, it's important to stay informed, follow your treatment plan, and communicate with your healthcare team. By managing medications carefully, you can live a long, healthy life with your new liver. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications, and cheers to a healthy life.